I'd like to now introduce Wendy Keech. Wendy is Health Translation SA's CEO. She's passionate about enabling the acceleration and translation of research into practice. She was with the National Heart Foundation as Director of Cardiovascular Health for 11 years, and she developed and led state heart health programs and chaired the National Warning Signs of Heart Attack strategy. She then moved on to SAMRI in many senior roles and as Executive Officer of the South Australian Aboriginal Chronic Disease Consortium, and she's had a strong background in strategic planning, health prevention and public health, to name a number of different areas. She's been in the position of CEO of Health Translation SA since 2018, and she's really advocating to bring together all of us to accelerate the translation of the work that we do and to have a positive impact on patient outcomes. And under her leadership, Health Translation SA now has 11 partner agencies and continues to do wonderful work. So Wendy, thank you very much, and over to you to close this session.
Thanks everybody, and thanks so much for coming, and what an inspiring night. You know, we talked about challenges, we talked about all sorts of things, but inspiring is the word that I've sitting with me at the moment, so hopefully you all feel that way. Look, there were some fascinating things, there's some interesting things, there's some frustrating things, there were some motivating things, but really there was a whole lot of stuff, and I think there was a comments that came from you at the end. We're here to support each other, to work forward and to see what we can do to actually make change so that we can have really strong and powerful contribution to end users and to patients who are actually going to, making a difference out there in the big wide world. And so I think the culmination of tonight, I feel quite fortunate to be here to really share with you that a vision for how this group, how this network can make the difference that we need in South Australia. So I'm just going to tell you really quickly, I know you've been sitting for 2 hours, so I'm going to really quickly just give you a tiny little backstory about how we got to be here, and then I guess how we go forward. I want to acknowledge firstly that Maria Macready's, who's actually is not able to stay here tonight for the whole thing, and Karen Glover were both instrumental in being part of the national direction of this network, and without their contribution we wouldn't be here. So there are a couple of people who've made a massive contribution, and that has led to both the National Steering Committee but also the setting up an Indigenous capacity building initiative as part of this network, and that's a national one. Monash Partners have really led this. That's one of the translation centres in Victoria, and Professor Helena Teed was really quite visionary and getting into the Federal Minister of Health at the time, who put up the money, well, helped the MRFF put up the money to come across to set up this national network. And that meant that ARA, which is the association of the alliance of all the translation centres, were able to set up things for their centres. So we got an establishment grant to actually put some money in to setting up this network over the 5-year period. It's not a lot of money. Health Translation SA is also chipping in a bit, but we're able to employ Tamara to actually do the work to make it happen. These things don't happen without glue. They don't happen unless you invest in people to help drive them. So that's something that we as an organisation believe needs to happen, and we will continue to support it. There's been some funding to support early career researchers, and there's hopefully some of them are in the room that have been funded. There's 4 in South Australia, and we hope that continues, so with more funding to really fund people to get on with their careers and build it. And there's about to be some co-design grants which are going to be released it's just happening at the moment actually. And there's 9 women's health research priority areas which are going to be part of the grants going forward. So there's a set-up phase which is called the seed projects, and then there'll also be some co-design projects, and there's opportunities for all of you to think about getting involved at the national level. So there are, my next slide, 9 priority areas. And if you're interested in any of those, I just encourage you to keep watching, because there are opportunities to not only mingle with the people in our state, but to mingle nationally. And Marion Eckert, who's on the steering committee, as you met earlier tonight, she will be able to work with us to bring that together. So that's an exciting opportunity for this network moving forward. And I'm sure you see yourself in some of those things. But there are all sorts of interesting people across the country who are wanting to link up. And the ultimate thing is to have really strong groups in these 9 areas that win lots of money, that we can actually put it to good use. So I guess I'm trying to set a vision for you around where you can connect to South Australia today, tonight, the sort of network we're building right here, but how you can connect to the bigger picture as well. So where to from here? We hope there'll be more networking events. Obviously, it's based on your response to tonight, but having 200 and whatever people sign up, we feel like there's something there. We're thinking about the regularity of those and how often they should happen and where and how and what and all those things, but we want you to contribute to that. We want to have capacity building activities, so we need those to be niche and to meet the needs of the people who are in the network. We want to have opportunities to showcase your work, and as we just heard, opportunities to advocate for change and advocate for the things we need. So all of those things are part of what I'm asking you to take away. Don't just leave it to me to do or to Tamara. It's actually about you embracing the opportunity and working out how you can be part of the change that we need. We're asking you to support us to support you. So a quick feedback opportunity. There's this little thing up there, which I think is called a QR code. Now they're around the place, and you can actually just give some quick feedback on tonight. But we're going to bother you with a very brief survey tomorrow, because we do want to do this well. We want to get your ideas about where to go and then do some prioritisation so that we're actually meeting your needs. We will be... what's the next stuff? Oh yes, brief email, I said that. The networking members will be looking... oh, that's right. If you have come tonight or you've been receiving other emails, you're all automatically in the network. So you don't have to join the network, okay? You're in it, unless you opt out. And if you want to opt out, that's fine. We're broad shoulders, but you're in it. And so please encourage others to get involved. So people who are not here, you think that should be here, please encourage them to get involved. We've also got our Health Translation SA monthly newsletter, and there's lots of stories in that which isn't exactly this network, but there's lots of other things. So if you're not on our normal newsletter, I'd encourage you to get on that as well. And finally, thank you to the panel for your contribution, and thanks for sitting there up there now and me not letting you escape. Thank you to all the speakers that have presented today. I wanted to thank all the people on the screen there, which are part of the committee. So in the paraphernalia you've got on your chairs, I just encourage you to take a bit of it home with you and have a bit of a read or pass it on to others. The first bit is actually this one, with the yellow banner at the top, is a bit about the network and about what it means, what it's trying to do and what it's achieving in the priority areas. You've also got this nice one that has just some information. I know it's old school having it in paper, but we wanted you to get your hands on things. And that tells you about the amazing women that have come together in the steering committee for probably the last 8 or 9 or 10 months, really starting to vision about what this could look like. But I want to really highlight the ones that I've got in red up there, who are the ones that led the working group for tonight. So we are encouraging working group type things so that people can you can contribute to the next one. If you think, oh, I loved doing this, and I know Deb's had a good time, and I know, actually, a great story, Deb and Shilpa have been working on this group together, and until tonight had never met in the flesh. But not only are they working on this network together, they've actually got projects that they're both involved in, but at a distance, and now they're part of something that's much bigger and worked really closely together. So there's good things. So put your hand up, lean in, as we've heard tonight, and get involved. And the last thing I wanted to do was to say thank you. Organising committee I've mentioned, steering committee I've mentioned. Tamara Hooper, stand up and take a bow. Tamara's done a great job, and she's inspired our whole team, many of who are here and who are helping, to just be part of this. And congratulations for your efforts, and it's really been a great thing to be watching, and for me, not having to do everything. So I'm being like, yoo-hoo, go girl. So that's great. The invited speakers, look, you've all really done a lovely job in really presenting a good story from all different perspectives, and thanks for setting that program up in that way, because it really made great sense and there was a really strong narrative through the night. And thanks to you guys and people online, the network members for being here. And there are now network drinks and nibbles, and I officially say we're launched.